evening, everybody. Dr. Apurv Mehra representing Conceptual Orthopedics. And in this session, we have Professor Gopakumar, Dr. Shailesh Pai, Dr. Rohit Prasad, and Dr. Dipendra Yadav, Dr. Nauful. And the aim of me being here is to give you a slight briefing of how the Conceptual Orthopedics postgraduate course in Delhi will be conducted. The course is dated on 12th, 13th, and 14th of November. And it is actually a conglomerate of teachers of lots of postgraduate courses in India. And they are going to travel from different parts of the country. And it's going to be an offline course where you will have patients, you will have interaction with the teachers. The first day, we have the trauma session. The whole day program, Dr. Shailesh will just share with you. And in this day, we will have two events. One is the inauguration. And then in the evening, prize distribution. After that, on 13th and 14th of November, it's going to be patients, teachers, patients, and students. And we start at 8 every day and we try to wrap up around 6:30. Practically, maybe longer, but we are going to be there till you are there. The premium subscriptions, the subscribers whose seats were almost complimentary are over. And by tomorrow, we'll be closing all of them. The non-premium subscribers' seats can be taken. And if at the end we have any seat left, it will be considered for the premium subscriber again. But I do not think so that's going to be a possibility. Also, please understand that this course is for you to clear your doubts. Day one, how to prepare, I think Dr. Shailesh Pai is the person to answer. Day 2 and 3, my suggestion is you read the different examinations, the clinical examination and different tests, so that when the teachers and the senior professors are explaining you, it is very easy for you to recollect and understand what they're teaching. Go to the basic clinical examination book if you're already a subscriber. And those who are not will be getting the book when they register for the course. Professor Gopa sir, before I hand over the mic to Dr. Shailesh, if a student is coming for a clinical course, for clinical examination course, what is your suggestion? How should he prepare? Is it okay if he prepares for the clinical examination of different systems, basic tests, and come and have a look at what the teachers are teaching?
I think there are so many cases which are often kept for the exams. They should have some basic idea regarding the theory also.
Right.
So it will be much better. For example, cubitus varus. They should know how to examine for cubitus varus. At the same time, what is to be done is the last question that is asked. So they should be prepared for that also.
Right. So students should be...
It may be a very short thing, because once they present the case and if the findings are correct and if the interpretation is right, ultimately we will have to ask regarding the differential diagnosis and the management. So the students should be aware of that also. Okay, so I think that is the best way.
Right, sir. So read the examination, common cases, basic findings, and how to manage them, because that's what is going to be discussed on that day. So now I'll request Dr. Shailesh Pai sir to take over the session. First of all, give a briefing about how the 3-day course will be, and then for the topic of the day. Thank you, Professor Gopa sir, and all the respected teachers and students. Have a great day. Thank you very much.
Thank you, sir.
Thank you. Thank you, sir. Thank you, Dr. Apurv. So we have been getting queries regarding what this course is about and how it's going to be held from different quarters, of course. So we just thought we'll just brief our students, and for those who have not registered, of what exactly we are dealing with when we are talking about this particular PG course that we are going to be held in the next month. So what's there in that? When, like just described, so November 12th to 14th, where it's at Shah Auditorium in Delhi, next to Civil Lines. And what is what many of you are confused. What exactly are we dealing with? So when this course was envisaged, I think it was about 5 to 6 months back, when the senior faculties thought that it's about time that we have a in-house physical course where the students can really see the patient, examine the patients, and present it, not unlike an offline this one where on the systems we are discussing things. So it was so discussed, and we envisaged what has to be done, and thankfully, with the help of all the senior faculties at the team Conceptual Orthopedics, we are able to plan in a very good structured program, which I will be briefly describing in the coming few minutes. So on 12th of November, we have the entire day for a trauma session. So the trauma course will be on the first day. Day 2 and day 3 will be the clinical examinations, what most PD teaching programs across the country has, that you will be allowed to take the case and present it in front of the faculty, and there will be live discussions and interpretations of your findings, plus demonstrations of the science by the experienced faculty. So the question many of you might be thinking is why we need to attend this particular course. How is this course a little different from what we are already exposed to, or what we can see on online platforms like YouTube or any other platforms? So it's my duty to just brief you that what you really get in this particular course is the combined experience of the legends of the conceptual orthopedic senior most experienced faculty. I'm sure most of the students who are in this particular forum right now, if you ask your professors, I'm more or less sure that 80% of your professors would have been the students, or they were examined by these faculty in their examinations. So that's what we get, that we can have a live interaction at our discourse, whatever we want to ask, clear off all your doubts right there, so that by the time we step out of the auditorium on 14th November, we are a different person from what we were on 11th November. So that's what you really get. Briefing about the trauma course, how is this different? Yes, you might find enough trauma conferences, trauma talks on YouTube or other platforms, and why one should attend this particular course is because we have structured it very differently from what you would otherwise find in any regular specialty conferences also. So divided into multiple modules. In module 1 is what we deal with the didactic lectures, where there are we deal with the basics of trauma and fracture management. So we have the mechanism how we talk. Now all of these are video based. We'll be showing you videos of how exactly a fracture occurs. We know what happens, but we don't know how it happens, right? What mechanism causes a bone to be broken in a transverse pattern versus a wedge pattern versus a compression pattern. I mean, very few of us are inclined to know that, but these knowledge is really helpful from planning how you treat them. Okay, the biology of fracture healing, yes, a very common topic. I'm pretty sure most of you are aware of it, but this will be dealt with a little differently of how to use this particular knowledge in the practical aspect when you're actually taking care of the fractured patient. Conservative management of fractures, which is a long lost art, which most of us feel, I'm pretty sure most of us have forgotten this art, and this is where we are dealing with what has to be done, in which conditions, even in current day scenario, can we manage a fracture conservatively. Reduction tips and tricks, biomechanics, all these have been dealt in theory, but practically how to use this particular knowledge in coming across any problems that we might face on a day-to-day basis when we deal with the fractured bones. And the soft tissue injury science management and fracture fixation implantology, we will be discussing about each of the implants that we use to treat a fractured case. So that's module 1. Right. So module 2 is what one needs, but what one does not find in any of the conferences. This is a totally concept-based discussion. That means that each concept that we are talking of will be presented in a fashion of a case, and it will be discussed badly. So we have screw-based modules, plate-based modules, where we discuss about the working length, what's the working length, what happens when you put a shorter working length, longer working length. All these will be with examples of live cases, in the sense where it was done, and it was done in a slightly different way, and where the results were not as what was anticipated, so that we do not repeat those mistakes what others have done, so that we get a better outcome of our patients, right? What is an angle stable concept? What is the advantage of this? Now, each of these are not lectures, these are concept-based discussions. So we have cases being put up where only this particular point is highlighted, and we understand how it has to be done, why it has to be done, so that we can have a good outcome, successful outcome at the end of what we are supposed to do. Stress distribution, which many of us do not really understand intraoperatively. We know that blocking plate has to be put, but we don't know how long the plate has to be, how we are supposed to use the plate in what fashion so that the stresses are distributed. And then when it fails, we try to blame the implant, or we try to blame the patient that he has borne load but rather he should actually be bearing loads if you have done it properly. So if you do not understand these principles, there is no way that the implant will help us in overcoming the mistakes that we really do intraoperatively. So these will be discussed with interactions and case-based, right? So reaming, working on nail size and types, whether it's X-fix, what is the type of incision that you do, how do we increase the stability, when do we convert to internal fixation. So all of these are practical issues that we do come across on a daily basis, but we do not really highlight this, especially at the student level, which actually should be imparted. Now, any student is what we feel is best learning in his initial periods. Now, once he learns a certain technique, it's very difficult to overcome that technique and relearn something. So this is what we feel, that these concepts should be really put into the students as early as possible and in the most right fashion. And interactive case discussion is the way forward to really be understanding any concept. Then we move on to module 3, in which we'll be dealing with the complications that we come across in trauma, whether it's vascular injuries, compartment syndromes, delayed unions, non-unions, infections, which is a huge issue, which is not really covered very nicely in most books or even conferences. And we really need to have a practical oriented approach of what we need to do once we come across with the infected scenario. So all these will be dealt in module 3. Then module 4 is once again a interactive case-based learning, where each of the fractures, whether it's from all the way from proximal, all the way from clavicle to AC joint, proximal humerus, humerus shaft, distal humerus, that way. So each of these regions will have one case example of what was the fracture, what was done, and whether the outcome is good or not, depending on all the learnings that we had from the morning. So we learn it and then we implement it to see whether the learning is giving a good result. So both upper limb as well as lower limb, all the fractures across all the regions will be covered. So this will be like a revision of the entire trauma that one needs to know, right? And then at the end, we'll have a separate lecture on implants and instruments, which will be not only beneficial from your exam point of view, which is one of the stations in the table viva, but also practically once you become a surgeon yourself, how do you, what exactly do you look for when you are buying an instrument or looking for an implant? All this will be discussed. So this is what, how the structure of the trauma course is. And what I can say for sure is by the end of this particular sessions that we have planned and the modules that we have planned, we are not making you a better surgeon. The skills will not be enhanced, but your knowledge and your decision making is enhanced. And it is very easy to understand that once your knowledge and the abilities are enhanced, the skills are enhanced automatically. To enhance your skills, you need to do more cadaveric dissections, attend more live surgeries. So that can always be taken care of, provided you know what has to be done and how it has to be done and why it has to be done. So once you know that, I'm pretty sure any one of us could very easily go and fix any bone with any implant that we have at our disposal. So that is followed by day 2 and day 3 of the clinical examinations, where all the different varieties of cases have been planned to be kept, which all we can anticipate it to be kept in exams. It's rather difficult because in exams anything and everything could be kept, but most oftenly what is will be kept in the exams will be covered in these particular 2 days. We have the talks by the authorities. So how really does one examine a hip? So which is one of the most commonest case which is kept in any exam. So this is by Professor Anil Dhal. Then we have spine examination, how to examine a spine case when it's given in exams. Then we have the knee examination, shoulder examinations. So all major joints are covered as, apart from the cases that you have, as also a lecture of, they will tell you the right protocol and the right way to examine and present the case in front of the examiners when you will be giving your exams. Yes, most of the varieties of clinical cases are anticipated to be covered, and you can discuss these. There will be live interactions, live groups where you can put in your doubts at any time. Because in most courses, what we feel is that the student is little apprehensive to stand up and ask questions. So we have an online forum, what we have planned, where you can really put in your questions and it will be answered live by the faculty, so that you do not have any doubts when you step out of the auditorium on that particular day. Right? And at the end of it, we have the 2 great demonstration and lectures on gait and orthopedics and prosthetics by Professor Dr. Matthew Verghese. Now, these are 2 particular topics which any resident feels difficult in his residency, because it's not well covered in most books, plus there are not many sources from which he could gather information also. but these are often asked in your exam. So whether it is on GATE or whether it is on orthotics and prosthetics, and this will be covered by the brilliant faculty, Professor Dr. Matthew. So this is what we get in on day 2 and day 3. And a few of you who asked how do we prepare, Dr. Apurv has already highlighted that for clinical examinations, you need to go through the clinical examinations book before you come, because that will aid on, it will supplement your knowledge. Because if you do not know anything, it will be very difficult to really catch what is going on, is what we feel. Because when the person is presenting, when your colleague is presenting on stage, whatever mistakes he makes or he might make, if you are able to catch it, is much bonus for you, rather than the faculty telling that this particular thing is not to be presented in that particular manner. So in that case, you are just trying to bridge your gap, but it's much better that you are way ahead. So please try to go through the book, the clinical examination book, which I am sure all of you have already received, before you come in. And like what Professor Gopkumar said, a bit of theory knowledge of the anticipated cases that you have is definitely an add-on benefit that you will have. You will have an upper hand during this course. And from trauma course point of view, chapter number 1 of Rockwood, chapter 1 and 2 of skeletal trauma, or chapter 1, 2, and 3 of AO trauma manual is what should be good enough to understand the biomechanics of fracture, and we'll be dealing with all the concepts anyway. So I feel this is how one should prepare for this particular course. So like promised, what we are not promising, we are not telling that you will be a better surgeon, but you will definitely be a better you. Your knowledge and your understanding of the entire different scenarios of orthopedics changes. And once you have that, it's your decision making which changes, and that is what is required for a surgeon. A surgeon is not what he does in the operative field. A surgeon is what he does even before he starts the surgery. It starts right with the way of planning, and to plan thing properly, one need to know things properly. So that's what we intend to change right at the root of where a surgeon should have his knowledge done, right? So that's to brief you about the highlights of the course and what we have planned. So if there are any queries regarding the course, we will take this at this particular time. And after that, we will go ahead with the chapter.